Now let's talk about communication with our patients who may have some sort of disability. So the first one is patients with hearing impairments. And sometimes we'll have a deaf patient and we will have a hearing impaired patient. And so there is a difference between deaf and hearing impaired. So determine if the patient is deaf, and oftentimes it's not on our request anywhere, and so you go out to the waiting room calling someone's name and they're not going to answer you if they are deaf or hearing impaired. Hopefully they have someone with them, but that doesn't necessarily mean they do. So hopefully somewhere along the line somebody has clued you in that who this patient is. So you have to, oftentimes you need to speak to that person, face to face. So because oftentimes they might be able to read lips. You can determine if they have any hearing aids. Again, they are smaller, so they're not as obvious as they were several years ago. But you certainly need to ask them, okay, about their hearing level. And that doesn't mean, what's your hearing level, but try to assess what that hearing level might be. Is it none, or is it the fact they have hearing aids and when they lay down they tend to squeal, so they might take them out while they're laying down, and therefore they heard you when you called them, but now they're going to take them out. So again, that can change their level of hearing from when you called them to when they're a patient on your table. Facial expressions, body gestures, and touch enhance the communication. You might need to offer them some paper and a pen so that they can write. And you might need to also, write the instructions for them, because they are the ones hearing impaired. Most hearing impaired do have oral communication, but again, it really depends on that individual. So they might need paper and pencil, and you will need paper and pencil if they cannot hear you, so that you can communicate your instructions. Learn to use a lower tone of voice. Don't yell at them if they have hearing aids. Okay, reduce background noise. If there's a radio, some departments have a radio in the ultrasound room. Turn off the radio. When they're laying on the table, make sure you're looking at them and not at the monitor when you're going to speak to them. Never talk from another room. I think that one's common sense. If the patient can't understand you, find the other way of saying the same thing. Again, write it down for them if necessary. With vision impairments, they can have age-related macular degeneration with no central vision, cataracts. Glaucoma is, loss of eyesight over time quite often. So keeping in mind that you're going to need to guide them. They can certainly hear you, so you don't have to yell at them, but you are going to need to guide them and give very specific instructions on which way to turn, right or left. There's a step stool, help guide their hands so they know where the table is and where the step stool is. You want to give them the independence, but you want to communicate in a way that you are giving them clear instructions. Does the patient wear any prescribed corrective lenses? Sometimes you'll see people with sunglasses or darker lenses because of some cataract surgery. Have them hold on to your arm. I like them to hold on to the back of my upper arm. I don't mind that, or have them, kind of bring their hand under my arm and, hold on to my wrist. Be careful. Patients like to pinch. They like to kind of use their fingers to hold on to you as opposed to their whole hand. So be careful of that. But you have to offer your arm so that they can, and you lead the way. Don't let them lead the way while they're hanging on to you. Certainly, approach the blind person by saying hello. Ask the patients who are blind how they are used to doing things for themselves and allow them to continue to do that. Again, often the times, we might, you don't want to say, we're going to go down the end of the hall. They have no reference to where that end of the hall is. So you may say to them, would you like to hold my arm and I will, take you to the room. Tell the patients if you must leave the room, the reasons why, because they can't see you. The deaf person can see you leave. They don't know why, because they couldn't hear you. The blind doesn't know you've left the room unless they hear the door. And then they're going to get anxious and insecure because they aren't sure what that door closing was. Was it you, or was it somebody else coming in or out? And then use touch and tone of voice to communicate with patients who are blind. And remember to avoid the nonverbal responses. Like we're going to turn, we're going to go down the hall, and then you're pointing straight down the hall. Patients with speech impairment, patients who have difficulty understanding communication, stand where you're visible to them. Speak slowly and clearly in a normal tone of voice. Use common vocabulary in short, simple sentences. Give direction or requests in a simple manner, repeating or rephrasing the directions as necessary, and use simple gestures or pantomime for clarifications. For patients who have difficulty speaking, and again, give them, maybe paper and pencil. It's all right to assist patients with words they cannot say, but don't speak for them, and don't treat them as children. Okay, make sure you're always attentive to your patient. Patients who are confused, please, 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 please make sure that you walk them back. You stay with them at all times and you walk them back to their family member. Don't say, okay, you're all done and down the end of the hall. If they get confused and go right, they could be out the door. Make sure you get them back to their family member. Inpatients, sometimes it's a result of new medications. They might be saying things that don't make sense. It doesn't make sense to them. They kind of know they're confused, but they can't relate that they're confused. So sometimes they're going to give you information that might not be valid. These individuals should not be signing consent forms. They should not, unless they have somebody who is a power of attorney sign it for them. Okay, so again, speak to them, in simple and direct language. Try to get the response from them, but, if not, then you're going to have to find that different avenue. Is there somebody with them? If they're an inpatient, ask the nurse. Make sure you do not leave the patient alone, though. Patients who are disoriented, talk face-to-face with the patient and praise and encourage a patient's abilities and attempt to cooperate with your instructions. Thank you so much for doing that for me. Again, make sure you don't have music on, that loud music, some sort of, crazy music that might be on that could, also create some anxiety to them. Alzheimer's patients, again, make sure you stay with them. They might, be very lucid that day, and so help them the best that you can, and that includes physical as well, so they don't hurt themselves. Make sure that you don't necessarily lie and, if they're saying about, oh, my cat is laying here next to me, and obviously the cat's not laying next to them, please do not say, no, your cat's not there. And they're going to say, yes, they are. And you're going to say, no, the cat's not there. Just leave it be. What you don't want to do, though, is say, oh, yes, I see that nice yellow cat, sitting next to you when there's not any yellow cat there. So, oftentimes you don't want to argue with them, but you also don't want to, kind of confirm what they're saying if it's not correct. Patients with mental challenges, again, sometimes these are individuals that, kind of have maybe, lower IQ, maybe they are individuals that, are not going to be able to sign for themselves. So again, some of our autistic, I would say children, but they're growing into adults now. And any type of excitement may disturb them. So therefore, you want to keep things in a calm environment. And you do need to be patient, flexible, and supportive. And then, be gentle with them, give them the eye contact, and hopefully that will be what the recipe calls for. So there are other disabilities that we have not talked about, and maybe we don't even want to term them disabilities, but you're going to be dealing with the terminally ill. You're going to be dealing with pregnancies, the joys of pregnancy, the losses of pregnancy, the infertility. So it's learning how to deal with all of it in a professional manner.